Hello everyone, I am Dr. Ziyad. Welcome to the WAPC CPC mock exam 2. In this mock exam, we will go through all 100 multiple choice questions organized by chapter, just like the real CPC exam. I will explain you how to find the answers easily and quickly. So make sure to subscribe my channel and check out my playlist. Chapter 5 ICD 10 cm codes. There are 5 MCQs. Question number 1. A pregnant patient at 20 weeks of gestation without proteinuria is newly diagnosed with gestational hypertension. Which ICD-10 CM code best captures this condition? So there are 4 answers available. All are adjacent codes. So please take your ICD-10 CM code book and find the answer. Okay, in this case, you have to highlight this is a pregnant patient with 20 weeks of gestation without proteinuria but with gestational hypertension. When you look at the answer, you will see all the answers are with OCDs and adjacent codes. So you can directly go to the codes and find the answer using elimination method. O13 is gestational, that is pregnancy-induced hypertension without significant proteinuria. But when you look at other codes, O13.1, 2, and 3, you can see first trimester, second trimester, and third trimester. So you had to know this 20 weeks belongs to which trimester. So when you see the WAPC guideline, you can see the first trimester is less than 40 weeks. That means first 3 months is called first trimester, second 3 months is called second trimester, and third 3 months up to delivery is called the third trimester. So in this case, less than 14 weeks, that is up to 13 weeks, it is first trimester. From 14 to 28 weeks, it is called second trimester. After 28 weeks until the delivery, it is called third trimester. So when you consider this 20 weeks, it is belongs to the second trimester. So you have to code this condition using the second trimester code. So when you go to the code 013.2, that is gestational pregnancy-induced hypertension without significant proteinuria, second trimester. So this is the correct answer. So the correct answer is D, that is O13.2. If you are using the ICD-10 CM alphabetic index to find the answer, here you have to go to the alphabetic index. You have to go to the hypertension, gestational. It will lead you to the C, hypertension complicating pregnancy. So there you have to go pregnancy-induced hypertension without proteinuria. It will lead you to the O13 code series. Again, you have to go back to the tabular list and confirm the answer. So once you confirm the answer, the correct answer will be answer D. Question number 2. A patient fell into an outstretched left hand by slipping and sustained a closed fracture of the distal radius. Which ICD-10 CM code should be reported? So there are 4 answers available. Take your ICD CM code book and find the answer. Okay, in this question, you have to highlight this is a fell on left hand by slipping. And the fracture occurred here is closed fracture of the distal radius. So when you look at the answers, you can see all answers are adjacent codes. S52 and W01 codes are available. So you can find the answer using elimination method. So directly go to the codes. So when you go to the code S52.5, that is fracture of lower end of radius. In our case, distal radius means that is lower end. So that is correct. And the laterality is here left hand. So when you go into further codes, you can see for S52.50 is unspecified. 501 is unspecified fracture of the lower end of the right radius. 502 is left radius. So in our case, left radius distal fracture. So the correct code will be S52.502. But in this fracture code, you had to give the 7th code, that is the initial encounter or subsequent encounter, those kind of things. Here it is the initial encounter, so you have to use the additional code A. So here you can eliminate other 2 answers. So this S52.502, there are 2 answers A and C available. So you can eliminate this B and D. So let's go to the external cause of injury codes. So here when you go the code W010 is fall on the same level from slipping, tripping and stumbling without subsequent striking against object. Other codes 1.1 is subsequent striking against an object. But in this case, it is not mentioned any object. So you can use this one, W01.0, that is fall on the same level from slipping, tripping and stumbling without subsequent striking against object. Here also you have to use the 7th character. So there are 4 codes available. So for the numerical order, you have to add this 2x's and A. That is for initial encounter. So the correct answer is A. So if you want to find the answer using the ICD-10-CM alphabetic index, first you have to find the fracture code. So first you have to go to the fracture, then go to the subcategory of radius, then go to the lower end, that is distal. It will lead you to the code series of S52.5. Again, go back to the tabular list and find the answer. Similarly, the external course codes, you have to go to the fall, then the subcategory of same level, then the category of slipping, tripping, and stumbling. It will lead you to the code series of W01. Again, go back to the tabular list and confirm the answer. Once you confirm, the correct answer will be answer A. Question number 3. A 60-year-old patient presents with an acute ST segment elevation myocardial infarction involving the left anterior wall. Which ICD-10-CM code should be reported? So there are 4 codes available. Take your ICD-10-CM code book and find the answer. Here you have to highlight this is acute ST elevation MI involving the left anterior wall. When you look at the answer, you can see all are adjacent codes available. So you can use the elimination method to find the answer. So directly go to the codes. So when you go to the codes, you can see I21.0 is ST elevation, that is STMI, myocardial infarction of anterior wall. But here the laterality is not mentioned here. But when you look at other code, I21.01 ST elevation myocardial infarction involving the left main coronary artery. So in our case, left anterior wall. So left coronary artery involved. So the correct answer will be I21.01. So the correct answer is answer C. So if you are using the alphabetic index, you have to go to the index of infarction, then go to the subsection of myocardial, then go to acute, then ST elevation. After that, you have to go to the anterior wall. It will lead you to the code I21.0. So again, go back to the tabular list and you have to confirm the answer. Once you confirm the answer, the correct answer will be answer C. Question number 4. A patient is diagnosed with hypertensive chronic kidney disease, stage 3, without heart failure. Which ICD-10-CM codes should be reported? So there are 4 answers available. Take your ICD-10-CM code book and find the answer. Here you have to highlight this is hypertensive chronic kidney disease stage 3. When you look at the answer, each answer having 2 codes and all codes are adjacent codes. So you can use the elimination method to find the answer. So directly go to the code. So first let's start with the I codes. So when you go to the I12.9, that is hypertensive chronic kidney disease with stage 1 through stage 4. Chronic kidney disease or unspecified chronic kidney disease. So here hypertensive chronic kidney disease part is fulfilled. So that is here hypertensive chronic kidney disease. So the correct code here will be I12.9. So there are 2 answers available with I12.9, that is A and D. So you can eliminate this B and C. On the footnote, you can see use additional code to identify the stage of the chronic kidney disease. So the staging, you have to use the additional codes, that is N code, N18 code you can use. So you have eliminated this B and C, and let's go to the N18 codes. So N18.3, that is chronic kidney disease stage 3 moderate, N18.6, that is end stage. So in our case, this is stage 3 disease. So the correct code will be N18.3. So the correct answer will be answer A. So if you're using the ICD-10-CM alphabetic index, first you have to go to the hypertension, then subcategory of with kidney disease, then go to chronic, then it will lead to the stage 1 to 4 or unspecified without heart failure. So it will be lead to the code I12.9. If the heart failure is present, you would use the code I12.0 instead. Then look up the disease. There you will get kidney, then chronic, then stage 3, that is moderate. It will lead you to the code N18.3. So the correct answer will be answer A. Question number 5. An asymptomatic patient receives pneumococcal conjugate vaccine during a preventive care visit. Which ICD-10-CM code should be assigned to indicate this encounter? So there are 4 codes available. Take your ICD-10-CM code book and find the answer. So here you have to highlight this is a pneumococcal conjugate vaccine during a preventive care visit. So when you look at the codes, there are 4 Z codes used. So you can use the elimination method to find the answer. So when you go to the Z code 28.2, that is immunization not carried out because of patient decision for other and unspecified reason. So A is not possible. B is Z79.82, that is long-term current use of aspirin. So that also not suitable. Z0.00, that is encounter for general adult medical examination without abnormal findings. So that also not possible. So the answer D is Z23, that is encounter for immunization. So that answer is correct. But here in this case, you can see this is a pneumococcal conjugate with the preventive care visit. So for the preventive care visit, you had to use the CPT code, and the type of vaccine, that is pneumococcal conjugate, you had to use the HCPCS code. So the ICD-10 code only covers the vaccine administration in general. So you can see the procedure codes are required to identify the types of immunization given. So the correct answer for this question is answer D. So if you use the alphabetic index, go to the ICD-10 alphabetic index. There you'll go to the vaccination, then go to the subcategory of encounter for. It will direct you to the Z23 code, that is encounter for immunization. On the claim, the Z23 code is paired with the CPT and HCPCS vaccination administration code and the specific vaccine product code. So the correct answer here will be answer D. So this is the end of the ICD-10 chapter. Please subscribe my channel and check my other playlist for the other questions. Thank you.